Good evening. My name is Sandy Bandetini, and I am the Early Learning Specialist for the Laguna Beach Unified School District. I am also a member of the Laguna Beach Early Learning Community Task Force. Just wanted to take a moment to thank you so much for making it to this professional development webinar tonight. So much can happen, especially these days between, right when you get home or right when you get back from work. And the fact that you have taken time out of your very busy schedule to attend says a lot about you. And it says a lot about your interest and your real passion, right? To find out, what can we do for these children and the parents in our community during this tender time. And so tonight you're going to be part of a professional development webinar titled Parent Wellness for Early Childhood Success. A couple housekeeping notes before we get started. First and foremost, if you could please mute your screen or the volume, that would be much appreciated. That way it will give our presenters an opportunity to speak without interruption. Secondly, feel free to grab a notebook if you're that kind of person. I know I am. What will be shared tonight will be very important information. And what you'll probably find is that not only will it resonate with you intellectually, but there might be some stuff that lands for you emotionally as well, because we're going to be talking about some resources for family in need. So please feel free to get a notebook handy, as well as we will be sending you the handouts and the slides afterwards. I will also be capturing if you have any questions during the presentation, please feel free to put them in the chat, and then I'll be relaying those questions to the presenters, as well as we're going to offer some time afterwards to answer your questions at a deeper level. So let's see. I think that's about it. So it is my absolute pleasure to introduce Hoda Shaki. She is a consultant with First Five, and she's going to bring us through the webinar. So thank you, Hoda.
Thank you so much. Thank you, Sandy, for coming up with the idea to put together this presentation. I'm really excited to share a little bit about what I've been working on and about why this topic is so important. So thank you all for attending and taking time away from your own evening to rest. Just looking through the registration list at the variety of professions represented in registering for tonight's event, it's really evident that this issue of parent mental health and parent emotional wellness is affecting so many people, and doing so across so many multiple sectors. And I think by you being here tonight, it gives me hope that families will be able to receive the support that they need much sooner, so that parents and children don't need to struggle needlessly. So this leads me to my why, and it goes back to when I would work with families as a pediatric nurse practitioner. I was very accustomed to noticing when a family was struggling with an issue and being able to help them find solutions to their problems. And what surprised me so much about postpartum depression is that oftentimes I would go months before realizing that one of my patients' mamas was struggling with depression. And it really hit home when within my own close family circle, I have had a family relative who was experiencing postpartum depression, and I had no idea. And I think back now and surprised that I didn't notice it, but her little baby girl would not smile at me. And I was like, why doesn't this baby like me? And she didn't smile at a lot of people. And I thought, oh, that's strange. She'll come around. And I didn't think twice. And it wasn't until about 1.5 or 2 years later that I realized her mom had been struggling with depression. And this is somebody who was close to me. So it made me realize that these issues are not easy to detect. Number one, because the signs are subtle. And number two, it's because it's something that we don't like to talk about. And so my hope from today's presentation is not that we all walk away feeling like mental health experts, being able to diagnose and treat depression or anxiety. That's not the intention, but it's really about feeling comfortable enough to be able to know how to reach out and lend a helping hand and to offer support when that feeling inside our gut is telling us that we need to do something. And so I just want to start with some definitions, because you'll hear me use some words interchangeably. But when we talk about perinatal mental health, we're talking about the states of mental health of a parent during the pregnancy and postpartum phase. So during pregnancy and within the first 12 months postpartum. And I like this slide because it shows the variety of different states that a mom can be experiencing. This portion is talking about after pregnancy, but it relates to during pregnancy as well. So the baby blues are very common, and that's why it's a large bubble. It affects about 80% of mothers, and it involves kind of ups and downs in mood, but it doesn't really get in the way of their ability to function and as a parent. It has to do with their just adjusting to becoming a parent and lacking sleep and recovering from delivery and figuring out how to breastfeed and all those things that come along with it. But generally within those first 2 weeks, the baby blues will resolve on their own. And when their symptoms kind of continue to linger or get worse, that's when we might start suspecting whether somebody has depression or anxiety, which you see the smaller bubbles kind of to the right of baby blues. And oftentimes you might hear reference to perinatal mood and anxiety disorders, and that's really referring to what goes in those two bubbles, the depression and anxiety disorder bubbles. They're often referred to as PMADs for short. I think on a technicality, I think I had heard recently that obsessive compulsive disorder is now its own category. I think Dr. Shapiro could confirm if that's right or not, but the point is that there are different types of mood and anxiety disorders that a mom can experience after birth, and not to be forgotten our bipolar disorder, which definitely needs treatment and care, and postpartum psychosis. Although rare, those are the cases where you sometimes hear about a mom harming herself or taking her life or taking her child's life. And it's not because she wanted to hurt herself or her child, but that she's not in her right mind to be able to be making decisions, and sometimes they end very tragically. And so it's really important to just be familiar with this and to try to intervene before symptoms get worse. And so when we talk about perinatal mental health, we're talking about we're referring to those mood and anxiety disorders under the depression and anxiety disorders, like I said, postpartum, but also prenatally during the pregnancy period. And this is not just limited, this is not a limited conversation to mothers, but fathers can be experiencing this as well. And so can any other caregiver really who is now taking care of that child. So whether it's a foster parent or a grandparent or whoever it is taking care of that child during this perinatal period, we need to make sure that they are mentally well and have the support that they need so that they could happily take care of the child. So we are all experiencing this pandemic together, and there's no doubt that the COVID pandemic has brought on a lot of stressors to all of us. But why this is important is because we know from the data that stress actually increases a mother's risk of experiencing depression during pregnancy or after. And if you look at the graph on the right, it shows us that this is data taken from the MIHA survey that California conducts every year, the Maternal Infant Health Assessment Survey. And it showed that when women were surveyed in California, as the number of stressors in their life during pregnancy increased, their risk of experiencing depression symptoms during pregnancy or postpartum went up. And you can see how that jump how there's that huge jump after going from 2 to 3 stressors up to 4 or more stressors. There's such a great jump in their risk of developing pregnancy or postpartum related depression. And so now this survey was conducted before COVID, but now think about all of the additional stressors that families are experiencing as a result of the pandemic, and on top of that, isolation, where parents are not feeling connected to the support they need. So we can only imagine how much worse that experience is for parents. So that's kind of talking about the parent side. But we also have data to show that this is really stressful on the children. So even though a baby is very young and they can't really put words to what's happening, the data from this MIHA survey showed us that what happened during a mother's childhood, during her own childhood, can come back and impact her pregnancy. So when a mother experienced more than one hardship during her own childhood, her risk of developing depression during her pregnancy and postpartum actually doubles. And that's what the data is showing. So all the little children that we are seeing right now who are living through hardships and stressors caused by the pandemic, and maybe their parents dealing with mental health or substance use issues, they're experiencing hardships. And if we don't intervene to help those children, they will carry those hardships with them as ACEs or adverse childhood events into their own adulthood. So here's an opportunity for us to think about how we can help these kids to really break that cycle. So one way is to offer help to parents when we know that they're struggling. And another way is to be those stable, resilient adults that are there for those children during these hardships. And as we know, when little kids are experiencing ACEs and hardships, just having stable, resilient, caring adults, which is all of you and all of us together, can actually help that child get through that stage as their parents begin to heal as well. So going into the science, and this is not new to any of you, but we know that the mental state of a parent is so important to the kids that we work with, and we see it every day, and all of you see it very well. But you know that during the first 3 years of a child's life, their brain is developing more rapidly than any other time in their life. And that the role of the parent and the caregiver, or whoever those stable adults are around them, really has a positive impact on that develop. And we see in adult and child interactions how closely in sync that they become, that the parent mirrors the child and the child mirrors the parent, and that's how kids begin to learn, is through that close engagement, and that's what supports their development. So when the parent is off or that caregiver is off, the child will be off too. And I think I wanted to share a video that could sort of put this into words, or can illustrate this better than any words that I could come up with. And if you haven't seen the still face experiment before, brace yourselves. It can be a little bit shocking and intense to see. And if it is, I apologize. But what I'm showing you is an experiment where you're going to see a mother engaging with her baby girl and just playing and connecting. And then the researcher is going to ask the mother to turn her head away and to come back and to keep a still face and to not react the way she would normally react and respond to her baby. So I think I'm going to click over to the video, and by thumbs up or nod of heads, can you tell me if you see YouTube off, or if you up or still see my slides? Slides?
Slides.
Okay, let me stop share for a second and share again the video. Here we go.
Hoda, when you have a moment, I have a quick question.
Oh, okay, this would be a good time.
Where did you get those survey results from?
Oh, okay, that's California's Department of Public Health, CDPH, has a webpage on the MIHA data, MIHA, and there was a report that was published in 2018, and that was on the latest data that they had.
Okay, thank you.
Yep. Okay, now do we see the YouTube video?
Yep.
Yay.
Yes.
So we'll just show a brief clip of this. And you won't be able to hear the investigator talking, but I think just the interaction will say it all. So mom and baby are playing. And you can see how they kind of serve and return and mirror each other in their communication. So baby points, mom looks. Mom plays itsy bitsy spider, baby's responding as you would expect. Now mom is turning away. What? So instantly the baby notices something's wrong. She doesn't understand why, and she kind of goes into her bag of tricks of cues that she knows usually gets reactions out of her mom and nothing. So now she's irritated, frustrated. She starts whining, clapping, that usually works, and then she screams. And then she kind of looks around to see who's going to help me. Like, does anybody else see what I'm seeing here? And then she kind of starts to fall into despair and starts to cry. And that's when her mom sort of clicks back into her normal self, is able to engage her baby again and very quickly consoles her. And there's the happy ending. So no scarring here. I know it's hard to see, but she's not scarred. She's able to be consoled by her mama. And as I go back to are we on my screen? Are we back on the PowerPoint?
Not yet.
Okay, let me unshare. And while I switch back, please feel free to unmute yourselves and share any reflections you had about what you just saw. Or chat.
There it is. There's the slides.
Okay, great. Is this the first time that some of you see this video? No, some people have.
No, I think I've seen it before in another presentation.
This is, I've seen it.
Any reflections about seeing this video, or about what's taking place, or how you can relate it to what you've seen?
I personally feel like it's very impactful, the way that parent and child relations are, because if as a parent you don't really pay attention to your child and you ignore them, then you can see how that can really affect their development and the way that they are processing things. So definitely, I think it really shows and highlights how we can create stress in a baby just by ignoring that child. So that is very impactful to me, because sometimes we're not conscious whether we are ignoring our children or not. And sometimes we could be busy, but it really takes from us, you know, as a parent, to acknowledge that our child needs us and needs that attention, and not just ignoring them. Like mine is over here. Come on, go over there. That's pretty much about it. Thank you.
Thank you for sharing. Absolutely true. Sometimes, so kids pick up on these things quite quickly. So sometimes it's not paying attention to the child or providing that attention that they need when they're asking for it. And sometimes parents feel like, well, I'm not crying, I'm not screaming, I'm holding it in so they won't notice that I'm under stress. But did you all notice how quickly the baby realized that something changed? It was within seconds. That we sometimes kid ourselves when we think that children don't notice when somebody's struggling, but they're very in tune with that caring adult. And so even though verbally or physically we're not showing signs of stress, the children pick it up. And you saw how troubling this was for a baby who, you know, and we watched less than 1 minute of a clip, but imagine a child who experiences this day in, day out for weeks or months or even years. How does that affect their development? And thinking back to my little, the baby in our family, how does a child learn how to smile and interact if they're not receiving smiles back? So when we think about a parent with depression or anxiety, what are some of the signs that you might see in a parent or in a child when, or maybe that you have seen when they're experiencing depression? How might that show up at preschool, for example, in some of the other settings that you work with families?
Feel free to put your response in the chat feature. That would be great to hear your feedback.
Sometimes some of my clients that I've worked with that are like 2 years old have been disassociated and kind of disconnected. So like you said, the mirroring of how the mom was kind of gave this kind of behavior. But I wanted to also say something before talking about like how the child, so I'm thinking about how the children have been going to the grocery store or whatever with mom. Everybody has masks on, and I'm wondering what is going to be the impact of that. I don't know if anybody's doing research on it, but I don't know. That'll be an interesting generation.
Yeah, that's a very interesting observation. I don't know. My kids have tested and they said, we can tell you're smiling by your eyes, but I don't know if that's always true. Who knows? Yeah. Okay. So I think also mothers may appear very overwhelmed, or maybe sometimes mothers and fathers might appear checked out, but it's really that they're extremely overwhelmed. And so the interactions that we're having are not what we're used to, and sometimes a bit frustrating, but it may be due to something like that. We know that children, I forgot to say this on the previous slide, that we know that children whose parents are experiencing PMADs within their own development have difficulty bonding with the parent and vice versa. We know that those children might have social anxiety and withdrawal when their mom is depressed or anxious. They might have behavioral issues. They might have aggression, trouble forming relationships, and they might be that one kid who's labeled as the difficult child, right? We all have had experiences where we know of that difficult child or that difficult mother or that difficult father, but maybe something else is going on behind the scenes.
Hoda, there's also a couple more comments here.
Thank you.
A couple people, one person said that for families with depression, I think the children are sometimes unable to regulate emotions, which is really very, very true. For some families, they show up late, they forget items. When the child cries, the parent feels ashamed. Families that are disconnected. And, you know, I think it's important to say, you know, I'm imagining sort of that drop-off time, right? Where you get that chance to see the parents, right? And that really being an invitation to kind of notice the parents. Because a lot of it, as you mentioned, Hoda, looks like very behavioral, right? But underneath the behavior could be something pretty significant, right? So great feedback, guys. Looks like I have one more mess. Yes, we have another question here. That is a very interesting question. How will a child react with a mask on their face? Yeah, that's something, maybe we should side table that and maybe explore that a bit at the end, but that's important too. That's definitely something to be, you know, worth a conversation.
So maybe we need to start signing emotions like hugs or something.
Yeah, right.
To go along with the smile. And yes, the children exhibiting behaviors when they're reuniting with their parents during crisis, that can definitely be something. I think about the mother who might be very intense and very worried about everything if she's experiencing anxiety. And then also the fathers as well. We don't want to forget about the fathers So while 1 in 5 women in California are experiencing perinatal mood and anxiety disorders, and we know that's probably higher because of COVID, nationally it's about 1 in 10 dads. And the highest risk factor for a father experiencing perinatal mood and anxiety disorders is when his partner is suffering as well. So you have one partner who's struggling and the other one's trying to be a rock, but eventually they also have trouble as well. So now you have both parents struggling, and imagine what happens to that relationship. So sometimes with fathers, it may look different, but there may be an element of being checked out or not involved with the children at all. And maybe it's not obviously that they don't love the child, but that may be their way of coping with what they're struggling with as well. And so kind of moving along here with the presentation, can get to our next speakers. Substance use disorder is an issue that we often don't like to think about or talk about, but we know that there's a very high co-occurrence rate. The latest I've seen was between 57 to 91% co-occurrence between mental health issues and substance use disorders. So we know it exists. It's probably more prevalent than we think. For many, we don't know, is it somebody who's experienced mental health issues most of their life and are now resorting to self-medication through substance use? Or could it be that somebody had substance use issues previous to having a child and now it's manifesting as mental health? We don't know, but we need to be sensitive that this is an issue that causes a lot of guilt and shame in parents. It's not something that any parent is proud of or wants to do, but that they need help and understanding and encouragement so they could get help coming off of this chemical dependency, which we know can't happen on their own. They need support. And if we can be an encouraging, non-judgmental person that helps them to get the support they need, that could really go a long way. So in 2019, First 5 Orange County and a number of partners formed a collaborative to really put together all the resources to enable people to begin asking these questions. And then when hearing the difficult answers, to know where to send people, to know where to refer them to find the resources. And we put together a perinatal mental health toolkit, which is up on the First 5 Orange County website and will continue to be updated. And again, the goal here isn't to become a mental health specialist who's going to diagnose and treat, but it's to be able to have the resources and the knowledge to look somebody in the eye and say, hey, I see you. I know that you're struggling. You will get better. I would like to help you connect to the resources and to get the support. That's what's asked of all of us. So I want to share a couple resources before I move on. And these are both resources, maybe ones that you're already familiar with, but they're really helpful when somebody is wanting to get help anonymously and isn't ready for that face-to-face in engagement. And so the Postpartum Support International is accessible to caregivers in that perinatal period. They can call or text and receive support. Help Me Grow, which you're quite familiar with, can really help on the child's end. And you're very familiar with how they connect families to development and behavioral support. But even just connecting families to the resources that are going to reduce the burden of their needs for basic support. And that's going to reduce the stress that they feel and will be one way to kind of elevate sort of addressing the social determinants of health to improve their mental health as well. Finally, with Help Me Grow, another incentive will be that sometimes parents are more willing to seek help for their child than for themselves. And so Help Me Grow may be a resource to find ways to help their children with their social and emotional component as they themselves heal. And it may be their motivating factor. A few free resources that are in the mental health toolkit, perinatal mental health toolkit, are Moms Orange County. So before the pandemic, Moms was able to actually do home visits on a regular basis and really provide support that moms need to avoid isolation and just to help them through that stage. Now they're providing those visits virtually, and they also have mom and dad support groups that are going on as well virtually. NAMI Orange County National Alliance on Mental Illness has a great peer-to-peer mentor program where parents can be paired up with somebody who's got lived experience with mental health or substance use disorder, and they can do weekly check-in calls for 12 weeks and really just show them the light at the end of the tunnel that you will get better. I've been through it. You can do this. And that's very encouraging as well. And that's phone-based. And then Healthcare Agency has a parent wellness program for perinatal mental health that's also free. And then OC Links is a county resource as well that you're probably familiar with that can help parents and caregivers find where they can get mental health or substance use disorder support.
Hoda?
Yes.
Quick question.
Yeah.
Will you be emailing the perinatal kit with after the webinar, correct?
Yeah, the link fell off one of my slides. I just realized that this evening. So I will send the link to the toolkit. Thank you.
Yeah, that would be great. Yeah, lots of interest in that.
Wonderful.
As well as I want to continue to encourage you to ask any questions that might be coming up as we continue this. Go ahead, Hoda.
Okay, great. Thank you. So in my final slide, I just wanted to say that it's my hope tonight that you'll walk away just being willing to ask that hard question and being willing to stand with the parent or caregiver as they take the steps toward getting support. So thank you for your time. And I'm now excited to hand over the mic to two people who are part of a wonderful new resource in Orange County. Natalie Swan, a licensed clinical social worker, is the interim behavioral health director at Mission Hospital in Mission's intensive outpatient program. And Dr. Kimberly Shapiro is the behavioral health medical director at Mission Hospital. So thank you both for joining us.
Oh, thank you so much for having us. And thank you for that wonderful resource you've already provided. It seems like you and already so many of the participants on this program already know so much about perinatal mental health, which is wonderful. I can tell by some of the comments already. So my name's Kimberly Shapiro. I'm a psychiatrist. I work at Mission Hospital, mostly in Laguna Beach and a little bit at Mission Viejo. So we're right in Laguna's backyard. It's the main hub of mental health in South Orange County. We have programs for teens, young adults, and a new program that we've started for perinatal mental health for pregnant and postpartum women up to around 1 year postpartum, but we do go beyond that. So just to make everyone aware, there are a lot of outpatient resources at the hospital. We don't do very young children. That's mostly at Chuck, but we have connections there. So I just wanted to talk a little bit first. It's not even on a slide, but just sort of what we look for when we're looking at depressive symptoms. And we can start with like a young mom, either pregnant or postpartum, but it is generalizable to all adults. It's normal, I would say this first, it's normal to be depressed sometimes when you have something sad happen to you. It's pretty common now to be depressed and anxious in this time. There's some data out there that at the beginning of the pandemic, 45% of adults were depressed or anxious. And now 10 months later, it's about 55%. So nobody's alone in this, even the most healthy mental health people, including mental health providers, are struggling during COVID. So it's very common. And I think it leads to a lot of opportunity to talk to people about how they're feeling more than you would before. I think it's a very nice entree into that topic. But what we look for, well, first let me say, if you're a pregnant or postpartum mom, while dads can also have similar symptoms, the cause is a little bit different. So from a medical perspective, female hormones are intricately related to mood. So estrogen, changes in estrogen, which happen when you're pregnant and then immediately postpartum, those affect your mood. We all, if it's mostly women on this call, I don't know, but everyone knows around your menstrual cycle, you can have different changes in your mood. Around menopause, different changes in your mood. And that's all because of hormonal changes in your body. So not that the outcome is necessarily different or the treatment is different, but Dads, it's just slightly different. Theirs might be a little more situational or from lack of sleep. So depressive, it's normal to be depressed sometimes when things happen, but what we're looking for more is a syndrome where people have depression most of the time on most days of the week for at least a couple weeks, at least 2 weeks. And then we look for other symptoms and signs, such as the biggest things are sleep impairments, not just because the baby's crying, but because you are not tired at night, your mind is racing. You have trouble staying asleep because you're waking up anxious, thinking all the time, can't fall back asleep, or early morning awakening, like you wake up with the birds and then you hear them chirp and that's it, you're done, it's 4 a.m. Other things, so people look extra tired. They look extra disheveled sometimes, a little unkempt, haven't brushed their hair, haven't put themselves together the way that they might. We also look for appetite changes, either a lot of increase in appetite or a significant decrease in appetite that can lead to weight changes. So that's something to look at in new parents too, not just from pregnancy, but from a depressive kind of perspective. We look for changes in energy. People seem very low energy, lethargic, have difficulty concentrating, might be moving slowly, might be talking slowly. It's obviously easier if you know them and you can see a major change, but these are some things we look at. Then, if people are talking to you about sort of things that Hoda said, hopelessness, helplessness, feeling worthless. A lot of depressed new moms will say, I don't feel like a good enough mom. People, catastrophize a lot of the things that they're feeling. I'm worse than other people. It's easy right now too to compare on social media. You look on social media, everyone's a perfect mother with the perfect family, with the perfect developmental child who's going to be a star. The reality is it's a whole range. And when you're depressed, you can feel like yours is worse than most people. And it's a distortion that we work on. And then obviously the very severe things that we get very nervous about are thoughts of hurting yourself or thoughts of hurting your baby. And just like Hoda said, none of these are anybody's fault. Nobody wants them. It's just sometimes depression can take a turn, and get very, very severe where psychotic symptoms become part of the clinical picture. And in terms of anxiety, I think you're absolutely right. We do see a lot of postpartum obsessive compulsive symptoms. Lots of, we call them intrusive thoughts. People can't get thoughts out of their mind. They just cannot stop thinking about that. And panic, just like you said. And if people have had trauma in the past, sometimes that comes up in the postpartum period too. So that's just sort of the explanation of things that we're looking for. As a psychiatrist, I have a particular interest and a training. I've done a lot of training in postpartum, perinatal and postpartum mental health. It's sort of a new niche topic in psychiatry and psychology that's becoming luckily more prevalent and more well-known in about the past decade, and it's getting a lot more attention. Prior to that, a lot of psychiatrists, even still now, but a lot of psychiatrists would not see pregnant women anymore. They would say, I don't know how to treat this, get you off all of the medications that you're on. It's not safe for the baby, when in fact, that's not true anymore. So there's a lot of data on women taking medications that are safe for them and also doing therapy. So first line would always be, in terms of treatment, would be therapy. It's called cognitive behavioral therapy. I don't know how many therapists are on the phone, so I hope I'm not telling you something you don't already know, but that would be the place to start for mild illness. And then more severe illness, it's always a risk benefit analysis. What's best for the mom and what's best for the baby if they're pregnant, what's best for the mom and best for the child if they're postpartum. And that includes an analysis of if you're breastfeeding, if there's other kids in the house, and how the mom is interacting with the other kids. So Hoda's already talked a lot about how a depressed parent interacts with their child. And in psychology, attachment theory, how kids interact with their parent, how they feel safe in the world, and how their relationships develop as they get older, is actually, there's a lot of data that's formed in the first year. So Postpartum depression can be actually quite detrimental, not only to the mother or the caretaker, but also to the child. So Hoda's video of a mom not interacting with her baby well, if they're not making good eye contact, if they're not speaking to them a lot, that can actually impair their development, their speaking development, their ability to interact with other, not just other people, the other kids, other people in the future, their ability to do well in school. So it's very impactful. Mom's mental health is impactful from gestation, from the pregnancy, because depressed or anxious or bipolar or psychotic symptoms actually affect the child's development. So this is a topic probably for a whole nother hour, but on how that actually affects the baby's development. And that's how a reproductive psychiatrist would do a sort of a analysis of when a mom needs medication, if the benefit of that would outweigh the risk to the baby just from having a depressive episode alone. So, mom or caretaker having lack of responsiveness to a child, not, seeing their cues, not, reading them books. And when they read books, they might not have the same inflection, the same change in tone of voice, the different characters, sort of a flattening that can impact the baby's development. Things you guys might see as educators, if you see a parent seeming neglectful, and someone wrote a great word, disconnected, versus on the other side of the spectrum, like an over-involved kind of helicoptering mother or parent. Neither of those parents are really reading the kids' cues. So that can be something you guys might see. And then someone else mentioned too, if kids are coming late to school, if kids are acting out and, trying to seek attention from educators or other kids or hitting other kids, that can be a sign that something else is going on at home. COVID has added an extra layer to all of this. All of the resources that we used to have are now stripped from us in many ways. Zoom is, one way to do things. Not everybody has access. Not everybody is technologically savvy, myself included. So all these, challenges, there's so many layers to get the help that you need. And if you have mental health issues or substance use issues, you're more likely to not be able to access those resources. The question about masks, I don't think we know how that will impact children yet. I do think there will be an impact. I think the results will be in the future. I think there's going to be a lot of research on that. And I know a lot of early child development experts are worried about that with kids going to school. I don't know the answer to that yet, but I do think that will be impactful. One thing that Sandy and Hoda had asked me just to briefly talk about is if you're noticing a mom or a parent that seems like they're struggling, how to approach them and how to ask them. So as a psychiatrist, by the time I see somebody, usually several people have told them they feel like something is going on. So it's easy for me. And when you do it a lot, it also becomes easier. But if you're just noticing somebody, I do think that COVID, because everybody is struggling, I do think right now it's a really easy way to talk about that with somebody else. Say, oh, I'm really struggling with this. How are you doing? I'm so tired. How is that affecting you? Even I do that with my own friends. Like, everybody's struggling with something right now. What's bothering you right now? How are you handling the pandemic? I'm reading, yeah. I can't see the whole thing, so I'll check on that later. But let's see. Yeah, I think it's an opportunity to engage with anybody in your life, but even these parents, where you're not going to be suggesting anything that they haven't already thought about themselves. There's no way you could suggest, something harmful to them. So I think that's an excellent way to bring it up right now. Just how are you coping with, a life-changing pandemic at this point? I do think everyone's struggling, and especially people with children are definitely have their, a different level of struggle than others right now. Okay, I think we should. I wanted to just have Natalie is my executive director of mental health at Mission Hospital. She's my right hand. We run all the outpatient programs together, and I wanted her just to give an overview of what our program does, who it's for, but I want everyone to know there's a lot of other resources besides this, like I said, and I want to be available to you guys for questions or help. And any topic that we can't finish tonight, we can always get back to you on if you want to send me an email or give me a call. Okay, thank you. And thank you, Natalie.
Thank you, Dr. Shapiro. Okay, if we can move along in the slide. So what we do at Mission is specific to an intensive outpatient program. And as Dr. Shapiro was mentioning, that's definitely not the first line of treatment that you would turn to. So just to go over some facts, 1 in 7 moms experience depression or anxiety during pregnancy or postpartum. And as Hoda had mentioned, 1 in 10 partners nationally suffer from postpartum depression. Again, that's typically the result of how their partner is also responding to their pregnancy or postpartum period. But what we do know is that when mom's mental health is compromised, it affects the entire family unit, their partner, their infant, and larger family system. So in March of 2020, so it has almost been a year, we opened the first intensive outpatient program in Orange County for pregnant moms and postpartum moms up to about a year, but we have had moms that are maybe 2 years out and still struggling because they haven't received treatment. So we know that these symptoms can progress greater than that year period when untreated. Now, what an outpatient program would do, like ours, is manage a higher acuity of moms, meaning that their symptoms are far more severe and necessitate more treatment than simply individual therapy and seeing a psychiatrist. We can just go to the next slide, please. Thank you. So our program is 3 to 6 weeks long, and we really target functioning in various areas with the goal of transitioning to a lower level of care, which would be your outpatient services, such as individual therapy and psychiatry follow-up. So in our program, our moms join 3 group therapy sessions a day, and we typically run groups 3 to 4 days a week. What we do there is we target various topics, but in part of being in our program, they receive a psychiatric evaluation with Dr. Shapiro, ongoing medication management while they're in the program, individual sessions, and family sessions while they are in the program. So typically, if they have a caretaker or partner involved, we make sure that we're doing sessions with them as well, because it really is treating the whole picture. Since COVID began, we were open 2 weeks, and then we transitioned to being on a telehealth platform. And by doing so, we've actually been able to reach a lot of moms that are all over California, from Northern California through Los Angeles, Inland Empire, down to San Diego. So it's been nice as far as expanding our reach and the ability for moms to get the support that they need from the convenience of being at home. As we know, it's really hard to juggle being a new mom and the struggles that can come up when you're struggling. And so in our setting, moms are encouraged, and this is of course prior to COVID, they could bring their babies, grow their skills through group therapy modalities, and that way we could see their interactions with their infant. But now we also encourage them to bring them on the screen, and so that we can see that level of engagement as well. And what we really want to get our moms to feel is just feeling confident about being able to continue with their daily obligations, like childcare or work or other things that have come up. And usually when they come to us, they just feel like they can't do it and they don't know what else to do. So they feel really hopeless, ashamed, and just like, this isn't what I should be experiencing. And there's a lot of guilt surrounded with that. Next slide, please.
Natalie, I have a quick question for you.
Sure.
Are those services free, income-based, or paid by insurance?
Great question. It is based on insurance. So our program works with commercial insurance plans, PPO plans, HMO plans, and Medicare. The only insurance plan that doesn't cover an intensive outpatient service is CalOptima or Medi-Cal.
Okay.
those moms are typically, and we provide referrals to any mom that calls, but we often provide referrals that their insurance would cover.
Perfect. Thank you.
Of course. So our team sessions are not offered in Spanish at this time.
One day, maybe one day.
But however, we do have a clinic that we do work with, our Camino Health Center clinic, which has Spanish-speaking therapists. And so we would provide referral there. And we also have individual therapy referrals for a Spanish-speaking therapist through St. Joseph's Orange maternal program. So we do have some resources that we would provide should a mom need that. Our team is all trained in perinatal mood disorders through PSI, the Postpartum Support International. Our team includes our psychiatrist, Dr. Shapiro, our registered nurses, and our licensed therapists. And each has, again, a passion and that specialization in treating moms. Next slide, please. Okay, so what makes our IOP unique is that we have a uniquely created curriculum. It all has 6 weeks of evidence-based group psychotherapy, and we include various topics, coping skill development, new mom self-care, how do you transition from what self-care used to look like before to what it feels like now, and getting adjusted, self-esteem and balancing your life, how do you bond with mother and baby, grief and loss. And oftentimes there have been different fertility issues, losses in the past, a lot of trauma that comes up, especially if they've had a traumatic birthing experience, that really also impacts their mental health. We talk about their emotional growth, particularly how they're regulating with their mood and their feelings. And also we focus on various education topics like depression, anxiety, bipolar, psychosis, panic disorder, trauma, and obsessive compulsive disorder. So all those things that Hoda had mentioned that comes up during this period, we make sure each mom gets that education because they can be better equipped to identify those symptoms and signs if it happens to them. And so you never need to feel like you're feeding somebody information like you're going to trigger them, but it's more front loading them so that they don't feel like it's something they shouldn't be asking about or speaking about, because a lot of the times, like the thoughts that moms have are so scary to them and they feel really nervous to share and extremely guilty. Why am I having thoughts to harm my baby? I need to wash my baby's changing table 5 times in a day. And if I don't do it, I don't feel like I'm being a good mom. I have to get up. And these tics that just develop over time. And so we really talk about education and how they can notice these different symptoms from a way of normalizing that it could happen. And it's okay if it does. Next slide, please. Okay, so lastly, this is our contact information. And it's our general phone number to all of our outpatient mental health programs. This, of course, is targeted for postpartum and pregnant moms. We do have adult programs and adolescent programs. And oftentimes what we see is that the mental health piece, again, impacts the entire family unit. So we will have a mom with her infant in one program, the spouse in our adult mental health program, and then the adolescent, one of her children who's a teen in our adolescent program. And that just speaks to how it just can impact the entire unit. And that's okay. The most empowering thing for us is knowing that, these families are coming forward and asking for help and receiving it. And as Dr. Shapiro is mentioning, that tiny pill that you might take can make a world of a difference versus white knuckling it through the first year, thinking that things are going to get better and impacting a variety of issues when they don't get better. So that's everything I have. And of course, said, we're here to be a resource. We get callers, not necessarily just for our intensive outpatient program, but just needing resources of where to turn to. And we're always happy to provide referrals to therapists, psychiatrists, other programs, and just hear what the need is.
Yeah, we have a lot of connections, I would say, all over California, but especially in Southern California, from LA to San Diego. So if we're not the right program, that's fine. We have other programs. We have connections to other reproductive psychiatrists, psychologists, therapists. I think we just have our finger on the pulse a little more than an average, or a lot more than an average, psychiatric clinic. One thing I just wanted to mention, someone asked about insurance. While we do take commercial insurance, we have a support group. It's an online support group now that's completely free, insurance blind. It doesn't matter. It's a lot of drop-in. So that's available too as at least a baseline resource. Our reproductive psychiatry nurse runs that. And so that way she gets to know potential patients. She can give resources. People are going through so much right now. Not everyone has even time to do this kind of program. So, she can get to know anybody and give them some help, or even just call. We're just trying to make this less stigmatized, more out in the open, give people some options. We can't be all things to all people, but we're trying to at least, put a footprint down in the community and see where it goes. I think, over the next decade, I think this will certainly spread. We'll have a lot more to offer. But for now, I think we've had a lot of great success in this program. And we're really just, the feedback is wonderful. We're doing something that not a lot of other people in the community are doing. So
we do have a quick question here. And then, but before I say, I just love what you guys are saying, because really tonight is an invitation for these professionals, all of you that took time out of your day to hear this. It's not like we're asking you to be professionals in parent mental health, but we're asking you, and what we did tonight really was to offer you an invitation to find out more, right? To have that information so that when something occurs or you notice something, that you have some background and some resources and support. So thank you for that. A quick question, someone said, can a parent that has an adopted child go through those same symptoms? So,
absolutely.
Yeah.
I just wanted to clarify at the top that sometimes the source is a little different, but absolutely. I mean, you're raising a child, you're not sleeping well, or if you even get a teen later, there's just a child later in life, there's so many contextual issues that come up that can contribute to depression and anxiety. So it's through all of us through the lifespan. You know what I mean? If you're never going to get depressed because you have amazing genes that will never become depressed, maybe not. But, a lot of it is if you have this potential to have that, any kind of environmental hit can affect it. And parenting, especially in the age of COVID, is very challenging right now. So absolutely. An adopted parent, and adopted parents are also welcomed in the program. So and to our resources also.
I love this. Someone says, this webinar gives me a bit more confidence in asking the families. We have a few families that have new babies, and they keep saying a COVID baby, and that seems odd to me. Yeah, there's lots going on, right? There's lots of, kind of like what you had mentioned before, this COVID dynamic is tender for everyone. Mm-hmm. And it's also an opportunity really to reach out in a deeper way to people, right? Like when we have our mask on, maybe we're not talking as much. So maybe we kind of notice those informal cues that we kind of talked about tonight. But I think what we're all talking about is, what's really happening now. And so appreciative of a group of people who are working with parents and children having this conversation, right? Because sometimes this is a conversation that people don't have, right? So very grateful for that.
And that comment about, having a COVID baby, a lot of moms don't appreciate that language being used. Sometimes folks will joke around and say COVID baby, but some moms have been trying for a very long time. This was a planned pregnancy, or it kind of takes away from their pregnancy by calling it a COVID baby. Yeah. Like it's just not worthy of the same kind of attention, adoration that you'd give a baby at any other time. And because of COVID, there's so many things that have been taken away from that mom's experience with connecting with family, having showers, having those moments where people come together and unite. So it does actually impact the social isolation. And like we talk about, how does that with masking affect the baby later on? So there's a lot of barriers. But I think I appreciate everyone who's joined and who's curious to learn about how to approach and best be a resource. And I can certainly tell from the comments here, everyone really approaches it with a non-judgmental attitude and approach. And that is honestly the best way. It's just to open the dialogue and have a conversation of, I'm here to support you in any way possible.
Wonderful. Hoda, do you have any comments as we start to finish up? And should we open it up if anybody wants to share or ask a question or two? I think we only have a couple minutes left.
Yeah, just gratitude. Thank you so much, Nat and Dr. Shapiro, for supporting, and all of you for joining. This has been a great conversation. I've learned so much from all the comments in the chat. I've also included a survey link if you could take a moment to fill it out, just to help us see how we can best get this information out to as many people as possible. We'd appreciate it. So,
any last comments before we finish up tonight? Thumbs up if you learned something, right? I know if I can find that thumbs up feature, I certainly learned something. There it is. Nice, I see some thumbs up, yeah. And so, Hoda, will your information be on your slides, and if they needed to contact, all that information will be available, correct?
Yeah, our contact information will be available, and then in the follow-up email, we'll send out some additional resources. There's a lot of great handouts on the mission program, as well as I'll send out a link to the Orange County Perinatal Mental Health Toolkit.
Great, thank you.
And some information on some upcoming webinars that, I don't know, Sandy, if you wanted to.
Yeah, you guys will also be receiving, a couple parents had asked for some additional resources for families. And so I'm part of the Laguna Beach Early Learning Community Task Force. And so I'll be sharing a flyer with some supportive events for parents. Our upcoming event, we have a webinar this Wednesday on critical developmental steps for children 0 to 5. So if you're looking for a place to go next Wednesday, or this coming Wednesday at 6:30, I'll be offering that webinar, and we'll be sending you all a flyer for that as well. Yeah, I think that's about it. Let's see, anybody? Oh, 5 new messages. Any books that could help us with children with issues? I can actually send, Hoda, I'll send you tonight. I have a book list for parents that talks about different books that you can read that teach certain emotions. So I'd be happy to share that with you.
I've been looking into it a little bit. I found, I can send Hoda some information too. Yeah. For a very young child, there's a whole series of books that are beautiful. It's like a kid's book of, they're on Amazon, they're expensive. They're like $15 each, but they're really nice. And they have their own website too, covering topics from anxiety, depression, racism, feminism, but there's, some stuff about, there's one about COVID. They're really fantastic. And another really nice book that actually teaches the basics of CBT, cognitive behavioral therapy, which is the therapy that we use to help kind of retrain your brain out of anxiety and depression. So I can send that over to Hoda too. I thought it was a nice book for, for a kid that can understand it. It's like a little workbook.
Yes, please.
Mm-hmm.
Thank you.
All right. So looks like we're finished up.
Yep.
Yep.
I'll let you close it out.
All right. Thank you. Again, thank you all so very, very much for attending tonight's professional development webinar. We look forward to keeping in touch with you. If you need any information, please don't hesitate to reach out to us. And we look forward to keeping in touch, and we'll talk to you soon.
Thanks, everyone. Have a good night.